Hi, do you know what is the most searched query on Google? It's not IPL or Bollywood. It is, what is wrong with me? Yes, it's Google before doctors. But hey, do you really want to take the word of someone who may not know any better than you and me? I'm Vineetha Athrey. I'm a journalist and an author, and I welcome you to Mallige Answers, where I catch up with renowned doctors from Mallige Hospital to answer questions on health and well-being. Join me. Hi, so I was recently shopping in the local market area and I was surprised to see that on a 200-meter stretch, there were about 4 different clinics, each of them with the same board, highly confidential piles clinic. Which surprised me, and I found it rather strange that we don't have a separate heart clinic, we don't have a separate kidney clinic, much less a highly confidential one. So what is it about piles that warrants a separate type of clinic for itself, and more importantly, what is really going on inside these clinics that makes it highly confidential? I'm Vineetha Athrey and welcome to Mallige Answers. To answer this and more on piles, fissures and fistula, I have with me renowned surgeon Dr. Shivshankar Sastry. Hello, doctor.
Thank you.
Doctor, so suddenly there seems to be an increase in the number of cases of piles. Is it really because of our lifestyle? Our diet is a lot more spicy and we seem to be on the road a lot more. We are traveling a lot. We are sitting on bikes a lot more. We are sitting generally. It's more sedentary. Is that what has contributed to this?
I think that's a very well worded question. There seems to be an increase. There really isn't an increase. It's a lot more in public. There are a lot more clinics that are available. But yes, to a certain extent, I think our lifestyle does matter in the sense that there's a lot more spicy, there are a lot more eateries with spicy food available, and the consumption of a lot of spicy food does ultimately have an effect on the lower part of the intestine and can cause certain conditions which are related to what people call piles. But riding on bikes and driving has nothing to do with it.
Oh, that's an important clarification, because a lot of general public really believes that riding on bikes is like the #1 contributor to piles.
That has no connection with piles. Riding on bikes or sitting on a Rexine seat on a hot day does not cause piles.
So you mentioned piles and related condition, which means that there is a lot more than piles going on.
Yeah, that's an excellent point. In fact, when a patient comes with a problem that he or she thinks is piles, it's typically one of 4 or 5 different conditions. It could be piles, it could be a fissure, it could be a fistula, or it could be an abscess, which is a collection of pus. There are a couple of other things which I must mention, like cancer, particularly in elderly patients, which are treatable if diagnosed early. So when a person says he or she has piles, it is the doctor's duty to look and check which one of these 4 or 5 conditions the patient has, and then base his treatment and his advice to the patient based on what the patient has rather than what the patient says. The patient may just say, I have piles, because he or she does not know.
Interesting. So what is really the difference then? What is piles and what is fissures? What is fistula? Is there a distinction in terms of what you look and what you find and the symptoms and all of that?
Well, see, symptoms are very similar. That part of the body cannot give rise to different symptoms. There are just 2 or 3 symptoms. There's bleeding, there may be a lump, there may be pain, or there may be some pus discharge. Apart from this, there's very little else. Most often it's just some bleeding, or it may be a lump. So it's very difficult to tell from the symptoms alone what the person has. But when you actually examine the patient and when you look at the part, then you can say whether it's a piles, whether it's fissure, a fistula, or an abscess, or something else.
On that note, thank you, doctor. We hope you're really enjoying this series. Keep watching Mallige Answers. We'll come back and continue discussing piles, fissures and fistula.